joint pain, inflammation, and stiffness can become real obstacles in everyday life. Simple actions such as getting up, walking, or grabbing an object become difficult, slowing down every movement and thus limiting personal autonomy. However, there are some supplements that can help relieve joint pain, strengthen joints, and support cartilage health. But which are they? Let's go see them. Curcumin. Native to Southeast Asia and obtained by drying and then grinding its roots, turmeric is a yellow-orange spice, mainly used in cooking, especially in Indian cuisine. One of the main active compounds present in turmeric is curcumin, a molecule with antioxidant, anti-inflammatory, and anti-tumor properties. According to the results of many clinical studies, curcumin can help reduce joint pain and improve the overall functionality of joints in subjects suffering from osteoarthritis. This effect is due to its ability to modulate some inflammatory processes through the inhibition of pro-inflammatory molecules, such as cytokines, but also through the regulation of enzymes involved in the degradation of cartilage. Curcumin could therefore represent a valid aid in the management of osteoarthritis, allowing to reduce the quantity of anti-inflammatory drugs taken. However, further research will be needed to definitively confirm its efficacy and the safety of long-term treatment. Omega-3. Omega-3s are a family of polyunsaturated fatty acids considered essential, as the body is not able to produce them autonomously, but must be introduced through food. Used for their benefits on cardiac, cerebral, and visual function, omega-3s have also proven particularly effective in supporting joint health and slowing the progression of degenerative joint diseases. Omega-3s help reduce inflammatory markers in the body, protect joints from cartilage loss, and keep them lubricated. This is because they play an important role in maintaining synovial fluid, a clear and viscous fluid that nourishes and lubricates joint. Additionally, omega-3s may help alleviate joint pain, providing relief for those suffering from conditions such as rheumatoid arthritis or osteoarthritis. The results of some studies show that these polyunsaturated fatty acids may represent an interesting additional treatment to traditional anti-inflammatory drugs, potentially reducing the need for higher doses of painkillers, often associated with unwanted side effects. Chondroitin and glucosamine. Chondroitin sulfate is a high molecular weight polysaccharide, a long chain composed of sugar molecules. It is found naturally in the connective tissues of the human body, bound to calcium or combined with some proteins, and has the task of maintaining the elasticity of cartilage, preventing its degradation and reducing inflammation in the joints. Chondroitin is usually extracted from the cartilage rings in the trachea of cows or sharks, and then taken in the form of a dietary supplement. This is because, according to some studies, it has proven particularly effective in treating the symptoms caused by osteoarthritis of the knee and hip. A review conducted at the University of Montreal Hospital Research Center examined the effects of chondroitin on osteoarthritis. It was found to be able to modify the death process of chondrocytes, the cells that make up the cartilage tissue, as well as reduce the factors that cause inflammation and cartilage destruction. Chondroitin is therefore used to reduce joint pain and stiffness in osteoarthritis, thus improving joint health. It is often taken with another substance, known as glucosamine, an amino sugar that can be produced synthetically in a laboratory or obtained naturally from crustacean shells or fermented grains. Glucosamine helps maintain cartilage, relieve pain, and improve joint function. Glucosamine and chondroitin supplements, taken alone or in combination, are considered effective in alleviating symptoms caused by osteoarthritis. However, studies conducted on their benefits have produced conflicting results. While some studies showed an improvement in symptoms, others found no significant difference compared to the placebo. For this reason, further research will be needed to draw definitive conclusions on the clinical efficacy of glucosamine and chondroitin on the symptoms of osteoarthritis. Before taking them, it is always advisable to consult your doctor or a specialist, thus avoiding possible interactions with some anticoagulant and antiplatelet drugs. In conclusion, we have seen that there are some natural supplements that can offer valid help both in maintaining joint health and in alleviating joint pain and stiffness. Thanks to their anti-inflammatory and protective properties, these compounds can help improve the quality of life of those suffering from joint diseases. However, before starting any treatment, it is always advisable to consult your doctor to evaluate its compatibility with any ongoing therapies and to ensure safe and effective use.